MSM is a powerful supplement that can have many benefits. Research shows that it may be helpful in reducing joint pain, lowering inflammation, improving skin health, decreasing allergy symptoms, and speeding up recovery after exercise. Additionally, some evidence also suggests that MSM can boost the immune system and it may have cancer-fighting properties. Studies have shown that MSM significantly reduces inflammation in the body, and it also inhibits the breakdown of cartilage, which is a flexible tissue that protects the ends of your bones and your joints. Doses can range from 5 to 30 grams per day. Detox symptoms, though, can be noticed when you first start taking MSM. Therefore, you should start with a small dose and build up gradually until your body adjusts. One way to reduce detox symptoms from MSM is to take it with vitamin C. This helps to bind up any toxins released through the increased cell permeability that the MSM produces. Vitamin C is a powerful antioxidant that fights molecules that can trigger joint inflammation also, and vitamin C serves a role as a cofactor in collagen synthesis, the main protein in joint tissues and bones. The best form of vitamin C is liposomal, or then a non-acidic form. The worst kind of vitamin C is a cheap, acidic ascorbic acid. Cissus quadrangularis. It's also known as the veld grape or the adamant creeper. It's a plant that belongs to the grape family. Cissus is commonly used for bone health and weight loss. It's also used for conditions like diabetes, high cholesterol, hemorrhoids, and many others. Cissus has been shown to help reduce joint pain and to relieve symptoms of arthritis, which is a condition characterized by swollen, stiff joints. One 8-week study in 29 men with chronic joint pain found that taking 3.2 grams of Cissus daily significantly reduced exercise-induced joint pain. Magnesium strengthens bones, maintains nerves and muscle function, regulates heart function and blood sugar levels, and it helps maintain joint cartilage. Magnesium bisglycinate is the best form to use. In order to determine your dose, start slowly and increase until stomach discomfort or diarrhea are noticed. Then slowly reduce until you can determine your maximum tolerable daily dose. By splitting the dose into 3 portions for breakfast, lunch and dinner, it can also help to reduce any unwanted stomach discomfort. As magnesium is required by hundreds of enzymes in your body, supplementation can have profound benefits to many areas of your health after a few months of use. People with low levels of vitamin D often have joint pain, so vitamin D supplements may treat joint pain in some people who have a vitamin D deficiency. Upping your vitamin D intake has been shown to help with symptoms of rheumatoid arthritis. Vitamin D helps the body absorb calcium, which is essential for building strong bones. And too little of this vital nutrient can lead to having thin, soft, and brittle bones, which is known as osteomalacia in adults, or rickets in children. You can get a 25-hydroxy vitamin D blood test to assess your levels, and then supplement accordingly with vitamin D3. Vitamin D's action is enhanced when it's combined with vitamin K2. Our bodies need calcium to build and maintain bone. When it breaks down calcium in our bodies, vitamin K2 activates a protein that helps the mineral bind to our bones and to do its job. While research is ongoing, studies show that a higher vitamin K2 intake improves bone density and reduces the risk of bone fractures. There's also evidence that vitamin K2 supplementation reduces inflammation in rheumatoid arthritis by reducing CRP levels. Vitamin K2 may induce apoptosis in rheumatoid arthritis synovial cells also. Low levels of vitamin D and K2 have been implicated in osteoarthritis. The maximum amount of vitamin K2 that you can absorb is 300 micrograms per day. Therefore, more than this is not necessary. Calcium periarthritis is a condition that involves painful swelling around joints. It's known as a calcium crystal disease because the pain is caused by crystals of the mineral calcium rubbing against soft tissues inside the body. This is one reason that people suggest that you only get your calcium from food sources, as overcalcification, mainly through synthetic or cheap non-food source calcium, can cause problems. Also, don't try to get your calcium from pasteurized milk, as the acidic state that consuming pasteurized milk can create can actually leach calcium and make matters worse. Instead of drinking pasteurized milk, only use raw, unpasteurized milk, which contains valuable probiotics and enzymes, and doesn't have the acidic, denatured proteins that pasteurization creates. Many people with arthritis take gelatin. Gelatin contains collagen, and that's a material in the cartilage that cushions the bones in your joints. The idea behind this usage is that eating gelatin will add collagen to your joints. Other people take collagen. Collagen, it has the ability to keep muscles and tendons together and even rebuild your cartilage. In turn, it can help fight the symptoms of osteoarthritis. Collagen supplements rapidly absorb in your bloodstream, and your body begins using them to rebuild collagen within an hour. But it can take a little longer before you see the results. Doses of collagen can be anywhere from 5 to 30 grams per day, and you can purchase animal or fish source collagen supplements. Glucosamine and chondroitin protect cells called chondrocytes, which help maintain cartilage structure. In theory, these supplements have the potential to slow cartilage deterioration in the joints and to reduce pain in the process. In most studies on treating arthritis, the typical dose was 500 milligrams of glucosamine sulfate taken 3 times a day. Chondroitin, which is found naturally in your body, is a vital part of cartilage, giving it elasticity by helping it to retain water. Lab studies have found that chondroitin can reduce the activity of enzymes and substances that break down collagen in the joints. A typical dose of chondroitin is chondroitin sulfate at 800 to 2000 milligrams taken once per day. Joint pain, especially in the knee, due to arthritis, affects about 1 in 10 older Americans. Research finds that an ingredient in the spice turmeric can significantly reduce knee pain in people with osteoarthritis, but it won't improve swelling or change cartilage. This means that it should be combined with natural anti-inflammatory and cartilage support for best results. So doses of this extract is curcumin, taken at 2 to 5 grams per day. But due to curcumin's low bioavailability, its absorption can be increased by taking it with biopterin, which is black pepper extract, or by consuming it with a fat, like coconut oil, butter, ghee, or fish oil. 1 to 3 grams of fish oil each day can help to reduce the intensity of joint symptoms, like morning stiffness, tenderness, swelling, and discomfort. The omega-3 fatty acids present in this amount can also increase blood flow through the body during exercise, which can help reduce joint pain and swelling. You can look for a molecularly distilled EPA DHA omega-3 fish oil blend, and you want to avoid pro-inflammatory omega-6 oils like arachidonic acid. Metabolic acidosis is the buildup of acid in your body. Your kidneys help to keep the right balance of acids in your body. Your body can have too much acid for two reasons. Your kidneys are not balancing or getting rid of enough acid, or your body is making too much acid. Metabolic acidosis can lead to acidemia, which is defined as an arterial blood pH that's lower than 7.35. The only definitive way to diagnose metabolic acidosis is by simultaneous measurement of serum electrolyte and arterial blood gases. Many people, however, use pH test strips to monitor their saliva and their urine daily for an acidic pH. Metabolic acidosis may affect changes in your bone by directly inducing the dissolution of bone and stimulating osteoclast-mediated bone reabsorption, inhibiting osteoblast-mediated bone formation, and altering the serum concentrations or the biological actions of parathyroid hormone and vitamin D. It's for this reasons that a low-carbohydrate, sugar-free, alkaline diet would be recommended when trying to heal a severe joint problem. Boswellia, also known as frankincense, comes from the Boswellia serrata tree, which is native to India, North Africa, and the Middle East. Boswellia is taken by mouth for brain injury, osteoarthritis, rheumatoid arthritis, joint pain, swelling of the fluid-filled pads in the joints, known as bursitis, and swelling of tendons, known as tendinitis. It can also be applied externally as well as being taken internally. Devil's claw is used for hardening of the arteries, which is arteriosclerosis. It's also used for arthritis, gout, muscle pain, back pain, tendinitis, chest pain, gastrointestinal upset, fever, and migraine headaches. Research suggests that devil's claw may help relieve joint pain associated with osteoarthritis and may be as effective as the pain reliever diacerin. Cat's claw is an effective treatment for osteoarthritis. It contains antioxidants and anti-inflammatory properties. It can help joint pain, especially when taken with other anti-inflammatory herbs. Deer antler velvet contains over 300 bioactive compounds. It's been used for numerous health conditions for thousands of years. Next to ginseng, it's the most prescribed medicine in traditional Chinese medicine. Deer velvet has been used to reduce muscle aches and pains, improve the way the immune system works, and decrease inflammation. Deer velvet has also been used in people with osteoarthritis to reduce joint pain and improve function. Doses can range from 500 milligrams per day up to many grams. Be sure to buy whole powdered antler and not a deer velvet IGF extract spray. Deer antler also appears to work synergistically with green-lipped mussel. Due to its anti-inflammatory properties, green-lipped mussel extract has been claimed to reduce joint inflammation, helping relieve conditions like arthritis. Finally, CoQ10. Many cardiologists place their patients on CoQ10 to help cardiac function, as well as to reduce the bad side effects of statin cholesterol drugs. The supplement also may help to decrease the pain of rheumatoid arthritis by decreasing the bad inflammatory chemicals that lead to cartilage breakdown. Doses of CoQ10 can range from 300 to 500 milligrams per day. The action of CoQ10 can be increased by combining it with PQQ taken at 40 milligrams per day. Both of these work on improving mitochondrial function. You can see my other video on mitochondria boosters for more information about other ways to do this.